I'm a GP. I've always had an absolute fascination for how the brain and the body are completely interlinked. And I think it's an area in my medical education that was rather kind of neglected. And I got interested in hypnosis and neurolinguistic programming, and always searching for something else that I could offer patients, because a prescription and a long waiting list for some fairly patchy counselling, I'm afraid, sometimes didn't really seem to be very satisfying. And as the demand has increased, the resources have gone down. And I'm very much a believer that we need to be empowered as individuals to kind of look after our own health, because the state and the NHS are not going to be there all the time to bail us out. So my other hat is as chair and trustee of a charity for young people with mental health problems called YPCS, Young People's Counselling Service. So we do what it says on the tin, and always looking for something else to add. And I was told about Caroline and TRE by one of our previous trustees, and it all looked very interesting. A lovely website, beautifully written, lots of references. But my kind of scientific head was saying, got to be a bit cynical, got to be a bit analytical here. And something struck me on the website that resulted in me booking to go onto the workshop. And that was the comment by Professor Gordon Turnbull, who in PTSD terms is extremely well known. I'd read his book, I'd heard about his work, and his comments really struck a chord with me. You cannot talk trauma out of the body. And I went, yes, that's what I've thought for years. And here finally might be an answer to that frustration. So I went to a workshop with my friend who's a psychologist. And if I'm honest, we went with quite a cynical kind of view, but an open mind. I don't believe all the answers lie within the kind of traditional kind of health space. In short, we were blown away. I was not expecting the quality of teaching, the kind of safety netting, the concern, the passion, really. And I totally get why Caroline and Daniel have really earned over the last few years. They've taught, they've walked the walk, they've driven the miles, and they have gained a massive amount of experience, because it becomes almost a compulsion and a privilege when you have people who share their story and share their pain with you. It's a privilege, but it's even more special when you've actually got something you can offer them, and something that actually works. And I've got patients who have trusted me and my recommendations and have seen some really, really great results. Since then, we've worked closely with here, and we're about to start a project with the police, which I think is fantastic. And what we'd really like, I'd love to be able to prescribe this. I'd love to be able to offer it for free. I'd love it to be taught in every school, and I wish every employer would offer this to their staff. I think it's really got that amount of potential. So massive congratulations. Looking forward to doing lots more projects with you in the future. Thank you very much.
So yeah, I'm from the police. I've got 20 years service in various different forces across the country, various specialist teams, from bomb teams to missing people. And it wasn't really until I found myself on my knees, really, where two special people in this room, Caroline and Dr. Graham, introduced me to TRE. 10 years ago, I'd have probably said I was bulletproof. At that particular time, I found quite a lot of holes in my armour. And TRE was recommended to me by Dr. Graham, and it kind of fit every kind of hole that I felt personally that I needed. I wasn't one for talking. I definitely wasn't one for taking tablets. There was a lot of stigma in the organisation for asking for help. For me, this really just fit the bill nicely. So after a year of practice in TRE, the results for me have just been outstanding. I can't really say anything more positive about Caroline and Daniel than I believe, as Dr. Graham, that this should be something that's offered to every frontline worker, especially now with COVID and the challenges that we face. I think there's a lot of pills that get thrown at police officers and a lot of talking therapy, but this just brings a different perspective, and I think Judith hit the nail on the head, really. It's all about perspective for me, and realising the power of your own body. And Caroline really brought that about within the course. And for me now, the vision's sort of got bigger. Caroline's helped me in a big way. and it would be really nice to repay her now. So we've got a sort of pioneering project within the constabulary now, where we're going to take 30 police officers and we're going to start gathering data now. So what effects will it have on 30 individuals? And the whole sort of basis of that really is to bring about that change. And I think there needs to be a cultural change around well-being and stress and the conversation that goes around it. And I think TRE can complement that so well. And if we can bring that positive data, then I know that we can start knocking down the walls of these OHUs that are really quite resistant to things like TRE. And I think it's about time that we started knocking them walls down and really introducing something that's so effective. Because there's a lot of officers out there that are probably feeling a little bit down, but there's a lot of officers out there that I know probably this could possibly save their life. And that's no exaggeration. So it's a huge pleasure to be part of Caroline Daniel's journey. I think their emphasis and motivation and professionalism just shines through. But they've got some great personality and great characters there as well. It's just a privilege to work for, and hopefully together we can get, within all emergency services, TRE being an option on the list, because for me, it's done a hell of a lot, and I'm a huge advocate.